All right. Well, more and more people are joining, but since it's already 1 o'clock, I would like to start with what is already the fourth webinar on the impact of COVID-19 on our efforts to end FGM. I'm very, very excited about today since we have two amazing youth advocates, activists that are joining us. Next slide, please. So we have Natalie Robi Tingo from Kenya, and we have Dr. Mariam Dahir, who I will introduce after we have also, I've also introduced to you the co-organizers of this very nice webinar. Next slide, please. So I'm organizing this webinar today together with Stories to Action. Stories to Action is a very nice and exciting new platform that is co-funded by Sanitizer and also Adriana Das. And I would like to give the floor a few minutes to you, Sanne and Adriana, to explain to the audience today what Stories to Action is. So please go ahead, the floor is yours.
Yes, so hi everyone, it's great to see so many people in this webinar. We are super excited to be joining Anna-Marie in today's webinar where Stories to Action, essentially Stories to Action was created as a platform for young people to actually share their stories about how COVID has impacted their sexual and reproductive health and rights throughout this pandemic. On the website, we also share different resources, and we have a survey for young people who are interested in, sharing also what the circumstances are that they are facing. So aside from this all, we also like to engage a lot with different partners. So in the spirit of that, we were very keen to work with Anna-Marie for today.
Thank you so much for that introduction. So it's been also my pleasure because I think it's very important to, when we talk about ending FGM in general, to focus on the youth. This also comes to the forefront when we attend women's rights conferences, UN conferences, but I think it's also very important when we are in a crisis situation like COVID-19 to listen to the youth, to listen to young women and girls, and also get an idea of what they find important and what they want and what they see as solutions. So thank you very much for co-organizing and also for joining today. So the outline of today's webinar looks like this. Next slide, please. So I will give a very brief presentation, a short introduction. Then we will listen to Natalie Robi Tingo, who is the founder and executive director of the Msichana, I hope I pronounce it correctly, Empowerment Kuria in Kenya. Then we will listen to Dr. Mariam Dahir from Somaliland. She is a medical doctor and the chair also of the Youth Anti-FGM Somaliland organization. And then we have a Q&A session. And as we did with the previous three webinars, I really want to encourage a lively discussion. And we have some tools to also that we would like to try during this webinar to also enhance us being interactive, and also I would like to engage you to take part in the discussion. So feel free during the presentations to ask any questions in the chat box, but we will also interact in different ways. So bear with us. Next slide, please. So what I would like to do is to look back at the first three webinars. And when I do that, I would like to, first of all, thank you. I would like to thank you very, very much for all the lovely emails that I have received So actually Janet Chapman and we took the initiative to organize the very first webinar when COVID-19 just happened. And a lot of things were happening on the ground. There was no research, no data, and we thought it is important, to share what is happening on the ground. And of course, back then, I didn't know that this would become a whole webinar series with many people following and with an email box that is overflowing. So when I look back at the first 3 webinars, I would like to thank you, first of all, for the very nice, heartwarming reactions. Next slide, please. So this is just one example of the many emails that I received. It is really heartwarming. It is really nice, and thank you so much. It's also good to know that many of you feel that the FGM world is connected in a way through my webinars, and at times of social distancing, I mean, we're all at home. This is a way to interact, to share experiences, but also to have some feeling of interconnectedness. Next slide, please. So for those of you who attended or attend only this webinar for the first time, the first webinar was organized in cooperation with Hope for Girls Tanzania, together with Janet Chapman. It focused on the situation in Tanzania, and Robi Samweli shared with us how she was dealing with the COVID-19 situation in her 2 safe houses in Tanzania. Then the second webinar focused on the situation in Kenya, since there were quite a lot of newspaper articles showing very worrying trends about the increase of FGM in different areas in Kenya. So that's why I decided to focus that second webinar on the Kenyan situation, where we had 2 very nice presentations of activists from the field who shared with us how COVID-19 was impacting their work. And the third webinar, about 3 weeks ago, focused on the situation in Asia. So we had 2 activists from India and from Indonesia who shared with us how COVID-19 was impacting their work, and how COVID-19 actually put a halt to FGM in that part of the world. Very interesting as well. Now today we focus on the effective and meaningful engagement of the youth, as I believe that is crucial to end FGM, and especially in times of crisis, and COVID-19 is a clear crisis. Now what I did, and that is thanks to my research assistant Franz Josef Biermans, I provided all PowerPoint slides and also all recordings of the previous 3 webinars on my website. So you see the website here. I will also share my slides, of course, again after this webinar with all the participants. Next slide, please. So if I look back, I was actually quite impressed with the amount of participants. So I had about 250 participants from all over the world. I just listed the different countries here. And I decided to record the webinars and then also put it on YouTube. And we had over 400 views already, which I think is really, really nice and heartwarming. Now, who attend this webinar? It is civil society organizations, but also UN agencies, governments, research institutes, universities. So it's a very broad audience, which I really like. Next slide, please. Then to sum up, what have we learned? Like, what are the key takeaways from the previous 3 webinars? Well, next slide, please. What I did is that I asked input from you. So I already noticed, since COVID-19 is a very new virus, a new pandemic, there is no academic research, there are no articles published in journals, and therefore I invited you to share with me your experiences. So I asked you to provide an answer to 4 different questions: the potential risks, the opportunities, the challenges, and the solutions. And I received many, many responses. And I would like to thank you for that, because without you, you know, we wouldn't have an idea of what is really happening. What I did is I took those responses together with existing research, but also policy briefs, technical notes of UN agencies, and I worked on that and made a document that you can also download from my website. And you see the first page here on the slide. And this is a living instrument, a living document. So after each webinar, when there's new information shared, I update the document as well. Now, what have we learned? Next slide. So yeah, you can. So what we have learned is that there is, on the one hand, if we look at the African continent, there is an increase, unfortunately, of the number of girls at risk of FGM. Why do we see an increase? Well, mostly because the schools are closed, the social distancing requirements, so there is a weakening in the social support networks. The girls are at school, not at school, they are at home. There is also a clear interlinkage in many African countries with child marriage. So since parents lose their livelihood, it seems that they are marrying off their daughters. And as FGM is a precondition to get married, we see an increase in FGM in many countries. We also see, unfortunately, that re-educated cutters go back to cutting. There was an article in The Guardian stating that cutters went door to door to see whether there were girls that they could cut, which is, of course, very, very unfortunate. And there's also what we see, a restricted access to health and SRHR services. So this is happening in the African context, what we have learned from the input I received from you, but also what has been shared during the webinars by activists in the field. What we also saw during our last webinar in Asia is that there is a temporary reduction or a halt to FGM in Asia. This has to do with the lockdown and the restricted movement, but also because FGM is highly medicalized in the Asian context, and hospitals and clinics are closed, or they became COVID-19 hospitals. So there is no opportunity, no way that girls can get cut in Asian countries at the moment. And I must say that this is mostly the case in bigger cities, and that in rural areas, traditional birth attendants are still performing the cutting. A third important lesson is that we can learn lessons from the Ebola crisis. So I discussed that also during the previous two webinars, so I won't go into detail right now, but those are the main takeaways of the previous three webinars and all the data that I have collected so far. Next slide, please. So when I'm looking ahead, I'm very, very excited to today's webinar, because we have two amazing activists with so much experience and who are so passionate about SRHR, about ending FGM, and still continue to work in times of COVID-19. So I will stop here. And if you go to the next slide, please. I think it's time for a Mentimeter. Sanne, I give it back to you.
Yes, so let me just switch our screen to share with you our Mentimeter. So as you can see today, we have two Mentimeters prepared for you. And for now, we would like to ask if you can join us on www.menti.com using either your phone or your laptop. And when you go here, you can add in the code to log into the Mentimeter. Adrija, I see you've raised your hand.
Yeah, hi. I just want to point out to everyone that you can either do that and use the code, or there's also the link that I've shared in chat for everyone to see. If you click on that, you can just directly put in your answers and you won't have to use a code any longer. You'll find the question and you can use it to use the link basically. Thank you.
Yeah, great. No, thanks for pointing that out. And so the first question is, which three words come to mind when you think of FGM, youth, and COVID-19? So throughout the presentation, you can still fill in the Mentimeter, and we'll go to the second one later on. It's great to see that there's already some points coming in. We'll revisit this after the presentations.
Yes, thank you, Summer. Thank you so much. And it's great to see that you are filling in the Mentimeter. In the meantime, I would like to introduce to you Natalie Robi Tingo. I already said it a few times, but I'm very, very honored and excited that you are here with us today. Natalie is an EU Young Leader for Development. She is also the founder and executive director of Msichana, oh, I'm so sorry, Empowerment Kuria. Despite COVID-19, she is empowering girls by providing sanitary products and preventing FGM, and I really look forward to hear your presentation. Natalie, the floor is yours.
Thank you so much. Good afternoon, everyone, and welcome to today's webinar. Thank you so much to the organizers and all of us who have taken time to join in. Thank you so much, Anne-Marie. So it is Msichana Empowerment Kuria, and Msichana is Swahili for girl. And I'm so sorry, I'm in the village, so if you hear chicken and everything at the background, please bear with me. As I said, I'm really honored to share my perspective on some of the work that we have done as young people to support the most vulnerable girls, but also to continue addressing and amplifying voices that, FGM that needs to end. And we need to make urgent steps, but also really be bold in our actions more than ever. And I'm really glad that issues around research and collecting evidence is already happening, because if we cannot document it and if we don't have evidence, then we cannot push for action. Next slide, please. All right, so I'll speak shortly on the potential risks of FGM for girls, and in two different categories. So girls who have not yet undergone FGM, how that looks like right now, and girls who are survivors. So things have changed over the recent time since COVID. The first cases were reported in Kenya up to now. So by the time COVID was beginning, the community was not really sure. It was still, the information was not, they didn't understand the information correctly, and there's a lot of myths going on. And then since all of a sudden the time has been extended. So for instance, schools are presumed to be opening in September, and that means now there's a lot of uncertainty. So initially it was just, are we sure things are going to go back to normal? But now the period of things not going back to normal is longer. And what that has done is that more and more girls who had not undergone FGM are increasingly becoming at risk because of the other factors that contribute to FGM. For instance, child marriage and teen pregnancy are a great contributor to FGM. This is why, so for a girl to get married here in Kuria, in the Kuria community, she needs to have undergone female genital mutilation. And right now, we are seeing an increase in child marriage and teen pregnancy. So for teen pregnancy is just for the parents to just reduce the shame, because it's considered that if you are pregnant while uncut, it's more shameful because no one would marry you. But if you're pregnant and you have been cut, then it's easier, because then you can be married to an older man, or you can be arranged to get married in the women to women marriage, which is called Nimbamboke. So increasingly, we have not experienced FGM here, but it's being done across the border in the Mara region and in Tarime, and that is predominantly the Kuria community as well. And we have had cases of cross-border FGM, but these cases have not been substantiated because of the most of the activists have been cut off from the community, but we are suspecting that those cases are happening. What is happening right now, there's preparations of FGM, and we are certain that these girls who have not been cut will be subjected to FGM if some of the things that need to be done will not be done. For instance, if stakeholders don't coordinate, if we don't have safe shelters already in place, they're currently closed. So if they're not in place, then that means more and more girls will be subjected. And for the girls who have undergone FGM before, so for those who developed risks, they're not able to go to hospital. And now we are seeing more girls who are either pregnant or are running away from child marriage. And those are some of the cases that we're handling. So for the pregnancies, what we are seeing as a result is unsafe abortion. So some of the clinics that we work with are reporting increasingly, incomplete abortions or abortions that girls are coming into hospital with either they were bleeding and they have to be supported. Next slide, please. Of course, I think in the previous webinars that Anne-Marie talked about, these are some of the things that have already happened. It's not a new thing for us. So for most of the activists here who we're in touch with, campaigns have been disrupted. We're not able to go out to the field, and we've all adjusted and used other means of reaching out to the community. So social support system for girls are unavailable right now, and that is because schools are closed. Programs that either act as safe spaces for girls are unavailable right now. And then loss of livelihoods for families increase the risks of FGM and child marriage. That has been shared before, and it's something that is not new again. And as stakeholders, as people who work with the community, we need to think on how then do we address issues around female genital mutilation and child marriage. And I think looking at livelihoods is an important aspect. Then for us, something that we found interesting is the increase in spread of rumors and myths. And I would like to share one of the things that is already happening in the community. So right now, the elders who are considered to have such a strong opinion on FGM are now saying that we are having the COVID virus because the community members have left their ways, their cultural ways. So they're saying that the gods are punishing us, and we need now to go back to the things that we used to do. And one of the things is that one of the ways that the community used to appease the gods is through female genital mutilation. And that means that in the next like couple of weeks, we will be seeing FGM being done as a result of that. And then we are increasingly seeing that girls who are not being cut are now considered to have, actually this is the funniest, they're the ones who are blamed to have brought the virus here. So they're increasingly saying that it's because you are dirty and you're considered unclean, and you're the reason why the virus is here with us. Yeah, next slide, please. So as youth activists and young people working at the grassroots, I believe some of the opportunities that we are seeing that has been brought by the current situation we're in is that it's an opportunity to use innovation to campaign, and we've seen incredible examples of that where young people are using social media to share real-time stories of FGM happening around the community. Young people are using community radios to share. One of the things we have done for us is that we have, during this time, we realized that many girls who we support will not have access to menstrual care. And menstrual care is one of the things that inhibits the well-being of girls. So when we began doing distributions, and during distributions, we use those platforms to identify girls at risk and also share information on hotlines and where they need to get help in case a girl is threatened to either get married or would be subjected to FGM. Research is another opportunity that we're seeing. So, for instance, we're already seeing that we need to build evidence on how COVID is impacting the well-being of girls and young women in the community, and in relation to female genital mutilation, child marriage, and other forms of violence and harmful practices as well. And in the next week, I think we'll be launching our study survey, and that is just to help in information gathering. So we're working with young people across the community as volunteers who will be working directly to help us collect that information, because largely the community here is rural, so we can't have access to online or online spaces for us to do the campaigns online. So we have to do it. We have to do it out in the field. And then social support system as essential services. So we have, and this conversation that is happening at the national level, but mostly young people are pushing that we need to include some of these spaces like the safe shelters and organizations, especially youth organizations and women rights organizations who are working at the community to as social support systems, and we need to be allowed to work with the girls and offer support. Thank you. Next slide. So some of the solutions, and this when I was thinking about this, I reached out to a few young people who are working in Kuria, but also other communities. And some of the things that they believe will be really important is strengthening community-led structures. So we already in the various before COVID and now there are already systems that were working. For instance, there was in some places there was a very strong community health volunteers network. There was a very strong engagement with the elders and the religious leaders. So we feel like that's really important still going forward, that we need to continue strengthening those systems. And we need to make sure that any initiatives that we're going to have are community-led. And then building evidence for action, again, that's very important. We need to make sure that we are gathering information, and so that this information can help guide action that needs to happen from the government officials to stakeholders across the sector. And then addressing SRHR. So I know right now there's a lot of focus in terms of the health and well-being of women and issues around access to SRHR information and services. And I believe that streamlining or including FGM in those messaging is important than leaving FGM as a standalone on its own. And then addressing other root causes of FGM like livelihoods, which is really important. We have seen that families are becoming more desperate in terms of the economic well-being, and that makes it easier for a mom who had changed her attitude towards female genital mutilation, really pushing her daughter to undergo FGM. And then most importantly, equipping frontline campaigners. And I think this is really important because some of the young people have given up their lives to just be out there in the community and to campaign. The best thing that we can do is equip them. So whatever small resource that is available should be directed directly to the frontline campaigners who work in the various communities. Thank you so much. I think that's the end. So thank you so much for listening.
Thank you so much, Natalie. It was a short presentation, but there were so many interesting things that you raised. Thank you so much. I saw already a few questions in the chat box. Please continue posing your questions, and we will address them during the Q&A session after the second presentation. But first, before we move to Mariam, it's time for a second Mentimeter. Sanne, I hand over to you again.
Yes, thank you. I will just pop up again the Mentimeter. Yep. So this is the second question that is on the Mentimeter. It is, what do you think will help with preventing FGM cases in the COVID-19 context? So it's an open question. Feel free to share any ideas you have or any suggestions you have, any solutions you have. And we'll get back to your responses on the first question and on this one after the next presentation.
Thank you, Sanne. So while you are sharing with us your excellent ideas, I would like to introduce to you Dr. Mariam Dahir. I also would like to thank Kat Catterson from the University of Sydney to make the connection. I'm very honored that Dr. Mariam Dahir is with us today. She is a medical doctor from the University of Hargeisa in Somaliland. She is also the chairperson of Somaliland Youth Anti-FGM Network. She's reaching out to young girls and women and educate them about FGM, but also FGM complications, for example, fistula. I have a lot of respect, Mariam, for the work that you do, and I'm really looking forward to your presentation. So the floor is yours.
Thank you. Thanks for Annie and everybody who is making these amazing interactions and making us to reach each other this difficult time and across the continents and beyond COVID. Thanks to Kitso, who I met her in Somaliland last year, and she connected me here. And I appreciate people who really interact and think of each other. So this is an amazing connection, and I really appreciate that. I'm Mariam Dahir, and can you hear me? I think everybody can hear. Sometimes using Zoom,
I can hear you very clearly.
Speak to yourself. So as you said, I'm a medical doctor. Since I graduated from the medical school, I have been seeing the woman who is suffering in the labor ward and who have FGM and really struggling with the labor and delivery. And some of the results of the FGM that's happening to them was fistula, and also the children who coming up with cerebral palsy and different complications, and they will live for the rest of their life. And all of that is coming from FGM. So this is what made me to look for beyond medicine, what is going on within the community and how I can prevent, how I can at least contribute to save one life. That is a woman who can produce 10 lives again, and in the future that are safe from complications and from any other problems, medical problems. So since 2012, I'm a campaigner. I speak from my heart, and I reach out to the women, young girls, and lately now we organized it like 2018 Youth Anti-FGM. That was a voice that never been heard in the FGM campaigners in Somaliland, where I come from. So we came together, we put Youth Anti-FGM, and as you see, Youth Anti-FGM is bringing the change. We wanted to bring change, and people hear us, because in Somaliland, youth as more than 60%, means the half of the community, half of the population we have are young, and then they can understand. So this slide is where Somaliland is. Sometimes people confuse between Somalia and Somaliland. And so Somaliland is used to be part of Somalia, but it's a breakaway region, and it's in the Horn of Africa. Next slide. Yes, the population is between 4 to 5 million. Infant mortality, as you see, the result of the lack of many systems in country is high. And also the maternity mortality rate, they say it is the second highest country in the world who have a maternal death in their community. Also literacy rate among women is, as you see, the number is so we are living and we are operating in a very difficult place. People living in small huts. They say it's the rural community in Somaliland are more than 40%, and women also, the childbearing age are more, and then they have more kids, and the death of the under 5 is highest in the world, and second to South Sudan. So this is the areas we have in Somaliland, and the difficulties that we are operating in where we are now. Next slide. Coming back to the FGM, it is like going back and forth, but sometimes they say it's 98%, and now, as you see, in 2011 it's 99.1, means every girl being cut. Yeah, means every woman in Somaliland is subjected to the FGM. So this is a difficult that the community also understand, and community is very believing in FGM and how it is, what they can say, why sometimes we ask ourselves why Somaliland, why Somali communities are highest and having this kind of a FGM performance and FGM practice is widely spread and accepted. And because the people think it is religious, it is based on religion, and then they believe in that, and the religion, the culture coming together, and it become like a most difficult thing that you can't take it away. They think, if you go to the next slide. As I said, it's 99.9 and among women, and when it comes to the 2011, and somehow it decreases and decreases, and up to now, the difficulties we have in Somaliland, there is no research wide and nationwide research that is connected on FGM. Everything you see, all the results, is all the figures you see from Somaliland, FGM rate and all of that is project based. Every project that they do baseline survey and then they publish their project, but there is no owned country level research that can be followed in a more regular way. And then you see how much it is more in depth in the rural area. It's 99.6%, and also in the urban it's just like a 1% difference. So and the type of FGM that is most widely used earlier, it was a type 3 chronic type, but now it looks like it's decreasing. And last research I participated, we figure out that it is up to 60% people are performing in type 3, while we have the other types are now emerging, and there is a lot of trend that the people promote what they call Sunnah, and it's a type 1, and it is difficult to make it because Sunnah is from religion and even the word, so they think maybe Veronica was from a culture and also like this, but touching the girls, not leaving the girls as they are, it's haram, so it's prohibited. So even some of the words that being used within the community, they say it when the girl being cut, halalain means making it halal, and you know halal what it means, and clean or pure and all of that. So this is what makes the Somaliland or Somalis perception on FGM very rigid. Next slide. And coming back, because I have a little time, I have a lot to say about FGM in Somaliland, how the people perceive and their behavior about it, and how they reject some of the changes that sometimes I came up when I came to FGM campaigns, like earlier in 2013, 2014, people used to think that I'm crazy and the women in Somali culture are not being, they have to be quiet, especially when it comes to something that's very sensitive and also touching the culture and the religion. And Youth Anti-FGM, we do campaigns mainly through social media, but also going to the schools and also to the universities, because we have seen this kind of 99% older women between 15 to 45, they are being cut. But under 15, they are safe somehow, as well as they can save their children. So why we are doing these campaigns and focusing more on youth is to save the next generation. This is our aim. Bridging the change, bringing the change, and also bridging to the people's ideas and saving next generation is what we are aiming to. And we do also advocacy. Now we are advocating that the FGM bill to be passed because law is not there. It's accepted. I can't say it's legal, but the FGM is accepted and nobody is talking about it. So we are really advocating, and as you will see the next slides, we made petitions, and up to now we have 1,500 petitions signed by youth who really wanted to reach up to 5,000 petitions that we can push the parliament to pass the FGM law. We also do workshops, seminars for women and also young men who are indirectly involved, because every woman, when you ask them why you are cutting your girls, why they say, who will be married? Who will marry my child, my daughter? Means the boys and the men are indirectly involved in for preference of who they are marrying and in their future, who they wanted their future wife. And also we make youth groups, and we have up to 6 groups from the different regions, all making the spreading the message and coming to the social media, as well as going to the schools and tea shops and reaching the word to the community. And we made debates and also dialogues between the intergeneration. We had a one panel discussion the other day. We bring a lot of different generations together and discussing why we want to continue FGM next future. Also between the two gender, why men wanted girl who been cut, while the girls are accepting FGM they live with it for the rest of their life. So this is the debates we make and tactile also, and irritate the people's minds and see what we can bring from the community. And using the agenda of the youth and their voice and their energy, and to make the FGM at least being sensitive and harmful, to see it's harmful. Next slide. Yeah, we are using actually social media mainly because even before COVID, we had we using social media, because Somaliland, literally people who's living in the urban area, they have smartphones, and they are living with their families, and either they are being accessing to Facebook, Twitter, and other platforms like Snapchat, Instagram. It means we need to follow the youth. Where are the youth? And we strategize that, and we found out that maybe, because they discuss something, if you see on Facebook, there is a Facebook groups that they discuss about the things that happen in their community and different things, but really we wanted to put also this in the platform that they can share their ideas. So as you see, we have like COVID, we posted on about every girl to be home, safe at home, and that kind of tackling their thinking about their, because if there is a boy or a young girl in their house and they don't know what is happening in their house, this kind of a message, when it comes to their screen, it can make them think, where is my sister, where are my siblings, are they safe? So this is what we really wanted to work with. Also, Youth Anti-FGM, we partner with different youth who are in the university, also in a different platforms, different programs, at least to go together and make it more powerful. So like the first, the one that in the left, and you see that we were partnering with the social workers from the University of Hargeisa, and also to associate leadership program are conducting in the ADBs. So we go to the ADBs, and the ADBs are where the TBA or traditional catalyst comes from, because this is the income generation for them. And next slide. And yes, we also do more campaigns on like making videos and asking other youth to film in their smartphones, in their home, and then in Somali or in English or another way that they speak about FGM. So this one we started early, like 2018, October, and still is going on, and we post it on social media and Facebook more often whenever we receive from different youth who are living in different parts of the Somaliland. Also, we have a petition, as I said earlier, and we have now up to 1,500 petitions that we really wanted to pass the bill, because bill will help us to bring the prosecutions to the court, and also make it more prohibited. Because now, if you catch a TPA or health worker, now the trend in Somaliland, like 20% of the cutting happening in hospitals. So we really wanted also them to be accountable and make the law in front of them. Next slide. And also we make more, like the one in the right, and Hisusin in Somali means reminder. So the reminder that the FGM is still there. COVID-19, you are panicking about COVID-19, but FGM also is happening. So this is what we brought it in that, and people are also sharing it and analyzing it more. So this is what making the vehicle going, but still we have a lot of difficulties, as you will see in the next slides. And the COVID-19, how it's affecting us, how it's affecting the youth. In the last 4 months, we haven't done any campaigns, because we used to, like Fridays, Saturdays, we used to go and talk to the community, and also we used to go to the schools, and also go to the other places that at least to tell people about the FGM. But now it's closed, so there is no much campaign. It's also the civic space. And what I mean about the civic space, all the civil society organization is shrinking, because the government is overtaking everything. They are focusing on it, and COVID-19, also social restrictions. They have committees on COVID-19 response. So there is no now currently space for the civil society to perform or to contribute any ways of the social welfare or other system that we used to do in earlier times. And also activities is it, because everybody is panicking about the COVID-19. We used to receive some small grants to conduct a seminar, at least to go to the other villages, or to help us on transportation, is because all the youth anti-FGM committee and also the youth anti-FGM groups are volunteers. So all of us are volunteers. It is part of it's like 50% of our time we dedicated to this. But we work on that kind of funding, and small funding is stopped. So we don't have that kind of much activities on the ground, but we are available on social media. This is the escape way. Next slide. Okay, I think everybody, and even this webinar, how it came on and everything is this 5 bullet points. The risk is that we are seeing still there is no data, and I was discussing with you and had maybe I'm thinking to do kind of a survey on a smartphone, or maybe smoke in survey smoke, and then we can make it and kind of like this one that you are doing now, and that kind of small survey we send to the youth and ask them, is there an FGM happening in your community? And also they report on that, and then maybe we can find out on that. But there is no yet, there is a feeling or gut feeling this is happening, because the time that the cut used to happen in Somaliland was the holiday, when the schools were closed. That is the time we used to have a peak of FGM. But now, this kind of closure, it will be increase of the risk of the girls to be undercut. Also, the GBV, and recently there was a rape case reported. It was a 13 years old girl in orphanage. That rape happened because nobody was knowing, and the orphanage children were in their home, and some men came in and then they raped. So this is what happening, and one, there is no much movement within the community, and nobody is knowing the other person where is living, and the condition is that they are, especially the girls and the young and the vulnerable children, and like the street children, all of that. So the rape will be there, and still we don't know where is the data, but there is a reporting is happening in one cases now, and it's early marriages. Although we never report in Somali or Somaliland, there is no reporting. Is that the early marriage is not within the GBV. Early marriage happens, and then the family takes, and people think it's okay. So we have no much data and understanding, but there will be under an early marriage. And also the economic challenges with the TPAs, they will come and perform FGM, and because of the lockdown, and their small business closed, and there is not much people moving on. So this is the things that we are really, the risk is that we are anticipating and thinking of it. Next slide.
Mariam, can I ask you to wrap up, please? Because
yes,
I would
this is the last
audience the possibility to ask questions. Thank you.
Yes, and so the solution is for continuity for youth anti-FGM. As when we were writing this, it is like we use actively on social media and do the AC material, messages, and all on the emerging. And I was thinking with the social affairs ministry and all of that. So I was talking to them and I say, maybe we are putting amplifiers to the COVID-19 and to bridge the message of the COVID-19 and the control measures. And we go to every community. Why we are not putting also FGM messages within that COVID-19 message and putting the resources together. So this is the thing is that we really think in the developing messages and go into the community with the other resources that's available. Also, hotline is for the rape and the early marriage, data collection, as I said, also the series of webinars and also live streams on social media like Facebook and Zoom and all of that. So I have done my presentation. Thank you, and I'm here for the questions.
Thank you so much, Mariam. That was very interesting. Thank you for sharing your knowledge with the audience and sharing all your insights. Before we move to the Q&A session, I think it's time to share the results of the 2 Mentimeters. So I will give the floor to Sanne again. Are you ready?
Yes. Just going to share again. So I see that it's already been populated quite well, as you can see. So 3 words that come to mind. I'm seeing vulnerable, which I think also was very well reflected. Oh, it's changing. Empowerment, I think that's also a key word that we're also seeing in what was presented by Natalie and also by Mariam, is that young people also feel the need to, engage and actually be part of the solution. Activist, powerless, brutal, definitely brutal, frightening. Yeah, these are definitely words that things that we stand behind. Energy, I think that's very, very interesting also to see. And I think that's also definitely something that was already mentioned, that power that young people have and that energy that they bring. And so the next one is, so what do you think will help with preventing FGM cases in the COVID-19 context. So I'll just run through them. So key contexts, more research and data, educating both girls and their parents, more education on the mode of transmission of COVID-19, the overall harmful effects of the FGM on the girl, woman, and her family, advocating for policy change incentives for advocates. Sorry, here skipped also. Empowering girls economically and guaranteeing girls education rights, which will give them the power to control their body and lives. Yes. Here, also down here, educating families, men and women. So education is really coming up. The political will to ensure governments at all levels ensure the law is upheld. A number of times local, a number of times local leaders will still allow for the, sorry about that. Will still allow for the vice and turn away from when FGM is happening, prosecution and fines, awareness raising campaigns using innovative things. I think innovation is definitely also something that really comes forward when you're looking at the work that both of the presenters already mentioned, using social media, different ways to reach out to girls. Medical workers who are respected and listened to by the community, to warn parents and communities in general on the deadly health risks of FGM, and educate about alternatives that are not harmful but equally worthy for girls. So that's a very unique point also, is looking at what is the role of medical workers in this field. So thank you so much. I think it's very interesting to see these points and to kind of have this engagement. And I think from here on out, we can continue the discussion. Before we move on, I also just want to thank Adrija, who's been catching all the different points that were mentioned and sharing this Mentimeter. So the floor is back to you, Anna-Marie.
Thank you so much. This is really interesting. And I would like to let you know that we will share the results of both the word cloud and the other Mentimeter with you. So you have an overview, as well as sharing data is, to my mind, key. We have about 15 minutes for the Q&A session, which is really nice. And the first question is for Natalie. There is a question about, and that question is referring back to our previous webinar, about the closure of safe houses and rescue centers in Kenya. So I myself was very worried, but with me many other activists in Kenya. And one of the participants is wondering whether you see that in your work, in the area where you work in Kenya as well, as there was a presidential decree asking all safe houses to close. So could you perhaps reflect on that?
Thank you so much, Anne-Marie, and thank you so much for all the amazing questions and the presentation from Mariam. It was really incredible and eye-opening. So unfortunately for Kuria, we do not have safe shelters. So what we've been using is temporary spaces like schools, where girls are normally accommodated with by organizations running the temporary safe shelters. So since the schools are closed, then that affects any attempts to do any rescues in the community. And for speak the larger context, we've been hearing, for instance, girls who had been rescued having to be taken back home, and they're still taken back home to the perpetrators who, for instance, marry them off. So it still puts them at a higher risk. And then even if you rescue girls, there's nowhere to take them, especially, for instance, in West Pokot, where there's been really a lot of mass cutting. So some of the youth activists there are calling for governments to open up the existing safe shelters and also open up schools so that girls can get their temporary. Yeah.
Thank you. That is very, very interesting. The next question is for Mariam. And the question is whether you see a correlation between the high rate of FGM in Somaliland and maternal and infant mortality. As a medical doctor, do you see a correlation there?
Yes, thank you for the question. Of course, there is a correlation between the FGM and because the people using population. As much as we know the girls who are coming to the who are really coming to the labor while they are closed and they don't have a maternal midwife who is supporting them in their rural area. As you see in my first slide, there's people living in a very remote areas between the mountains and in valleys and all of that. So reaching health system is very, so mainly who is supporting those young girls and women are TB, traditional birth attendants, which means that they can wait and the child may be breech or having an obstructed labor. So before they reach the hospital, they already either they develop complications or they die within. Because whenever I go, because now I'm leading one of the primary health care in Somaliland, and it is more it's more focusing on maternal, how we can reduce the maternal mortality in this region. And whenever I speak to the people, they will tell me that the lady who died 2 days ago, 5 days ago, having a labor. When you ask them, maybe that was her first child, which means that there's a correlation. There is no, I can't say like directly involved, but there is a correlation between the FGM and maternal mortality, and also neonatal death.
Thank you. Thank you for clarifying that. Kit Catterson, you raised your hand. Please go ahead.
Thanks. I have a question for Mariam. Hi, Mariam. Thank you so much for your presentation. It was incredibly interesting and informative. So you mentioned that about 20% of FGM is now performed in health centres, and these are they're called MCHs, I think. Yeah. I was wondering if you could speak to, do you know what's going on now in time of COVID about whether these kind of practices are still going on within health facilities, or if, the health facilities are now turning people away because of COVID. Do you know what the kind of situation there is at the moment?
Thanks, Kit. And yes, even the other services that we have, we were expecting the antenatal care, the immunization, family planning. The clients are going down because of the fear of the COVID-19. And people are running away from the hospitals, from the health centers. So maybe there will be a cut happening within the houses, and the health workers are following the children and the girls to their houses. So this is the one area. And when the health workers are not receiving clients, they get bored and then they go home. So this is one of the things that we are really, we need to look for it and see how that's happening. But the risk is still there. The health workers can go and perform FGM within the home, but the clients who are coming to the health centers are reducing, and hospitals are reducing by the COVID-19 and fear and stigma.
Thank you, Mariam. That is really interesting to hear as well. There's also one question for you about the situation in Kenya. As we all know, President Kenyatta made a plea during ICPD 25 that he wants to end FGM by 2022. How do you, the question is from Manas, what is happening with President Kenyatta's declaration that Kenya will eradicate FGM by 2022? And then all the current developments, for example, the very worrying trend in West Pokot.
Thank you so much. So I tried to answer a little bit of it on the chat box. So, of course, we are still on guard because that directive didn't just come as a word of a word that was just passing by. We took it very seriously, and we still holding the anti-FGM board, the government to account. So, of course, with the reason with COVID, it has slowed down, and everybody has shifted attention to try and curb the spread. And that's why you see some of the things, some of the measures that we put in place have put more girls at risk of FGM. So I think we don't know if things are going to change in the next couple of weeks in terms of the government, for instance, opening up shelters because that has not been addressed yet. But what I'm certain is that activists across the country are still online. There's engagement online, and they're still saying that the president said, and he needs to keep his word, and we need to see coordination on the ground, and need to see, for instance, in cases where FGM is happening, we need to see arrest. But honestly, on the ground, things are different. People really don't care about FGM. They're scared more of their survival, and FGM is just not really like an urgent issue, because then other issues of hunger and survival is for them, and FGM is part of that survival if you think about it again. So honestly, for us, what maybe our commitment is to continue to push the government the much that we can. But the 2020 eradication was a big ambition, and we still believe that we might not end it completely, but we'll definitely have done some good work to take it to the lowest level that we can.
Yeah, thank you for sharing, Natalie. I also see that Marco Alves is on the call. He from Burkina Faso, and you wrote in your introduction that you are using football to fight against FGM. Do you perhaps, if you're still there, do you perhaps want to share with us whether COVID-19 is also impacting your work in Burkina?
Hi everyone. Do you hear me?
Yes,
okay.
We can. Yes.
Well, we mainly work with schools. So as soon as the schools started to get closed, there was no activity at all. Quite difficult to have contact with the kids. But we work with multipliers. So our coaches, our football coaches that provide information about FGM and also HIV, they lived in the same places with the kids. So sometimes they see them and they ask how they are going and things like that. But must say it's really difficult to have information. Now that the schools have restarted, we have no longer activities for this month. We will start again in August. But we started to exchange with kids, getting information of the things of that's going on so far, and we are providing new material and kits and some kind of tools. Many of the ideas you've presented in previous webinars, we will use them for the next steps. So thanks again for sharing all these experience with us.
You're welcome, Marco. Thank you also for sharing your views here and for participating, of course. Are there any other questions, or maybe Miriam or Natalie, do you want to share something? There has been a few questions, but also answers about the law against FGM in Somaliland. Maybe you quickly want to reflect on that, Mariam, very briefly.
Yes, and Kate did it very well, and she is very well known in this area. And there is no law in all Somali regions, and Somalia, Somaliland, and the other regions. But there was an fatwa from the religious leaders in Somaliland. They were prohibiting the pharaonic type, but they were allowing the Sunnah. They said the Sunnah is compulsory as long as it's and I'm seeing somebody from in the comment that is saying Sunnah is Arabic. Yes, it's Arabic, and it's FGM, it's type 1. Means, and sometimes it goes to type 2. They cut more. They don't they cut more, like 1 centimeter. But there is no centimeter. They cut more flesh from the clitoris. Means so this fatwa were being applied by many people and take it because it is the highest level that the religious leaders can and breach something. But there was a backlash, so they said sunnah, but there was no, and then they said also the health workers must perform. So the health workers, some health workers refused it, and then they said we can't perform FGM because it's a violation of the human rights. And as myself and other groups, we were very challenging the religious leaders to change this fatwa, but still it decreases the level of the implementation, but still we have only that one. In Somalia, there is the FGM bill is in front of the parliament, as well as some regions that they are more ahead of Somaliland, but the Somaliland, we don't have a law or anything that went to the parliament yet.
Yeah, thank you for clarifying that, Mariam. I have the very last question for today, and that question is for you, Natalie. You wrote in the chat box that you're also worried because we will have mass FGM in the Kuria region. And then one of the participants is asking why there is mass FGM in the Kuria region. So could you perhaps share your thoughts on why there is a spike in FGM currently in this region in Kenya?
Thank you so much, Anne. So I was responding to Anne, who had shared, because recently, I think in the last 3 to 2 days, there's been a lot of conversation in the country about the increase in teen pregnancy across the country. And then we've also been affected in the region where I live. And I definitely can attest that teen pregnancy will lead to an increase in female genital mutilation. And so what we as stakeholders are speculating and really afraid that in the next month or so, it may be happening because of course kids, with the way the systems have changed, is that kids will be maybe in school in December, in November, and that is normally the cutting season. So the community, I think, is just waiting and waiting to see how the government would be, or is it being practiced somewhere else? And right now we have seen it being practiced in the West Pokot region. So when it happens in Kuria, it might not be in small scale, because again, all these other issues are pushing the community towards practicing FGM. So it's not issues around promiscuity will take lead in terms of curbing the girls' sexuality. And even today on the radio, there are several, when people were giving comments, I was listening to the radio as I was getting to the office, and then people were sharing the perspective, all of them are blaming the girls, and they'll be like, you know what, because the girls are not being cut, they're using the name in a local language. And all of them are blaming the girls, that, you know what, girls are not being cut, so they're misbehaving around the community, so they need to be taught a lesson. And that means, that sends a very strong warning, and it also really worries me and scares me for not happening. Yeah.
Thank you, Natalie. That's very good to know. Okay, I have one very last question of Corinne Whittaker. I'm sorry, Corinne, I already said it during my presentation, but I didn't have time yet to answer all the emails that followed from the different webinars, but I will come back to you. The question is to you, Mariam. Have young people been able to engage the religious leadership on the issue of Sunnah in Somaliland? Could you briefly, very quickly answer that question? You are on mute. Yes.
Just talk to you. And as Youth Anti-FGM, we really wrote a couple of letters to the religious leaders. We engaged them. We said, at least don't put it compulsory. It is Sunnah, even in Islam. If you pray, there is a prayer that is compulsory, and there is a prayers that are Sunnah. So can you put it? Can you remove this the compulsory word? So we are still engaging, although I'm not convinced to use that fatwa. But the young, especially leading by Youth Anti-FGM, we engage it many times to the religious leaders and giving them a chance to review their fatwa.
Thank you. Well, I think we can talk for another hour, but unfortunately time is up. I would like to thank all the speakers. So Mariam, Natalie, thank you so much for sharing your knowledge, sharing your insights. I would like to thank Sana and Adia for your assistance and your cooperation. It has been great. Before I say goodbye, I would like to draw your attention to the Global Platform for Action to End FGMC. I know that many of you are already a member and be part of it. Here you see the website, www.actiontoendfgmc.com. Here you can become a member, but apart from that, an initiative that we took is to develop a survey on the impact of COVID-19 on ending FGM. You will find a link here on the PowerPoint slide. I will also share it with you. And I would like to ask you to fill in the survey. It will take about 10 minutes to fill it in. There are a few open questions and we will use the information of the survey to also inform donors, inform UN agencies and other important stakeholders on what is happening on the ground in order to make the right decisions for the following weeks, months and years. I think that was it. Is there something you want to say, Sana, Adia, Mariam, Natalie?
I think I just want to thank everyone for the active engagement. Thank you to the speakers again. Yeah, that was it. Thanks, Anna-Marie. I think you really have been able to run a really successful webinar series, so it's a pleasure to be part of it.
Thank you so much. So before we say goodbye, I would like to ask you whether you have tips for the next webinar. Since I haven't decided yet what exactly the topic will be, so the homework I would like to give you is to let me know what you think is interesting, an interesting topic for our next webinar. Of course, it has to do with COVID-19 and FGM, but as you saw in the previous 4 webinars, there are many different areas or focuses that we could have. So I would really look forward to hear from you what you think is interesting to discuss next. If you have interesting people in mind who you think can share interesting insights on what is happening in the field, please contact me. Let me know. You find my contact details on the next slide. And then I would like to thank you again very much for participating. Please contact me in case you have any questions, and I look forward to see you again in about 2 or 3 weeks. Thank you so much and have a lovely day. Bye-bye.
Same, thanks a lot. Thanks for having me.
Thank you very much.